Hi, so this video will be about hamstring range of motion assessments. These are vital for activities requiring hip and knee mobility. The primary muscles involved are the hamstrings, which attach to the ischial, tuberosity, and insert at the tibia and fibula. The functions are hip extension and knee flexion, and the importance of each assessment are that the active straight leg raise gives insight into overall hamstring flexibility and its influence on hip mobility, while the active knee extension isolates the knee flexion capability, allowing a more precise analysis of hamstring length and knee mechanics during movement. For active straight leg raise, this assesses hamstring and hip flexor flexibility. To demonstrate, first lie supine with both legs straight. Raise one leg without bending the knee, moving through the hip joint. Place the inclinometer along the thigh of the testing leg from the greater chanter of the hip to the lateral epicondyle of the knee. Common errors include bending the knee or allowing the non-active leg to lift. For quantification and analysis, my left leg reached 70 degrees while the right leg reached 80.2 degrees, resulting in a 6.78% asymmetry. This is close to normative values, 70 to 80% according to Plinsky, but may benefit from additional flexibility training, especially on the left side because of the asymmetry. However, it is between the asymmetry cutoff within 1 to 10%, meaning it's in the normative range. To conclude, increasing flexibility in the left leg could reduce potential imbalances, which are critical in sports requiring symmetrical leg motion. Now, for the active knee extension, it evaluates hamstring flexibility and quadriceps control, essential for knee joint and health and stability. Lie supine on a flat surface with one leg extended flat and the other leg flexed at the hip to the 90 degrees. Actively extend the knee of the flexed leg, keeping the hip in a fixed 90-degree flexed position. Position the inclinometer on the thigh close to the knee joint. Make sure the pelvis stays at a neutral position. If it doesn't, this could indicate posterior tilt and could affect the results. Common errors in this test include excessive hip motion or rotation. For my quantification and analysis, my left knee reached 122.3 degrees and the right reached 122.9 with minimal asymmetry of 0.49%. While symmetrical, these values are below the normative range, which should be between 135 to 145, indicating a need for enhanced muscle control and flexibility in both legs. Between the asymmetry cutoff from 1 to 10, from 0 to 10%, it is between the normative range. However, improving flexibility may help enhance stability and range in knee-dominant sports movements.